It's always so interesting exploring how our hyperspectral imaging technology can solve problems in the real world. I'm currently investigating the use of the living optics camera for applications in dentistry, specifically for shade taking in dental applications. Shade taking is a very important step in any dental restoration work in order to assess the patient's natural tooth color with sufficient accuracy. The traditional method of shade taking involves using a shade guide and performing a visual assessment to determine which shade tap is the best match for the patient. However, there are some limitations to this approach, so ideally, we would like to use additional methods that directly complement the visual assessment and are capable of measuring the true tooth color without using a physical reference object. Spectral imaging can completely characterize the color of the patient's tooth by measuring the wavelength-dependent reflectance. The living optics camera measures spectra at over 4,000 points across the scene and with 96 spectral bands. My aim with this work is to not only explore whether we can accurately determine tooth color, but also to map the natural variation in color across the tooth surface. This has the potential to really support dental practitioners to create bespoke restorations that are an exact match to the patient's unique tooth color profile.